All right, I think we can go ahead and get started. Hello, everyone. Thank you for saying hello. So glad you're able to join us today. My name is Rihanna Durbin-Matrone. I'm the research coordinator for Partners for Advancing Health Equity. We are a research learning collaborative with Tulane School of Public Health and Tropical Medicine here in New Orleans. And today we're going to continue to explore the role of philanthropy in advancing health equity. As you know, this is the second in this series of workshops, and we also had a webinar. So we're just so glad that you could join. We are going to do some questions at the end. You can feel free to put them in the chat, or when we start doing questions, come unmuted or raise your hand. And so now I'm going to go ahead and turn it over to our facilitator from Grantmakers in Health, Arpita Jindani.
Hi, everyone. I'm Arpita Jindani from Grantmakers in Health, and I want to welcome you all to our workshop today. It's part of the series Better Health for All, the role of philanthropy in health equity. First, I want to acknowledge, great to see so many familiar faces and names in the participant list. Excited to see that. In our last workshop, we discussed trust-based philanthropy, and today we'll be talking about organizational practices and how to meaningfully engage communities and share power. Next slide, please. I'd like to briefly introduce Grantmakers in Health. We are a national organization dedicated to supporting foundations, to improving the health of all. We're based in Washington, D.C., but our work spans across the country. The slides provide all the details, so I'll avoid reading word for word, but I do want to mention that we collaborate with a network of over 220 funding partners that include foundations of all sizes and different geographical regions, ranging from Alaska to Maine and down south as well. Next slide, please. Before we get started, we want to engage you all a bit more, learn a little bit more about you. It'd be wonderful if you signed up on Mentimeter, how we did last time, and we'll pull up our first poll. I see folks are steadily joining. So the first question we have for you is, which phase best describes your involvement in health equity work? I know our audience ranges from philanthropic organizations to community partners to NGOs and academia. It'd be great to know where you all stand. More responses coming in. So based on, I'll just call it the donut or the visual, but donut is a good descriptor for a lunchtime call when folks are hungry. It clearly looks like majority of our attendees, majority of you are quite familiar with, deeply engaged in health equity work, either exploring possibilities or in the planning and strategizing stage or implementing initiative stage, and some are actually at the piece of evaluating. So it's great to get a sort of a baseline on where everyone stands. And thank you for your interest in this topic. I think we can move on to the next poll. Simple one, in 3 words or less. I know it's hard to do it in 3 words. If you could share, how are you engaging communities in your work? I see one response coming, more coming in. Focus groups, one-on-one meetings, through the partners, in-person convenings, community coffee chats like that, conversational listening, focus groups, intentionally seeking trust, social media health and education, community health navigators, lots of great ideas. More coming in, listening and learning, participatory grant making. So I won't keep reading because in the interest of time, we have to keep moving, but not to worry, all the perspectives will get captured in the summary and it'll be provided a month after the webinar. So thank you for sharing your views. I wish I could keep reading all this, but I will look at that in the summary. Before we get started, in sort of, before I introduce the speakers, I wanted us to root us in the socio-ecological model. I want to draw attention to this, as many of you might be quite familiar with this. There are many iterations of that. This particular figure used in public health, this particular one lends well to philanthropy. And I just want to frame our discussion because we are trying to understand what is the responsibility of funding organizations. So this figure provides a macro look at the community in which the funding organization operates, as well as a micro look at personal relationships among individuals and institutions. And together, one can see individuals, institutions, community lend to policy. They all influence policy. I won't dig further into this. I'll leave that to our speakers, but I just wanted everyone to have this visual and root us in our upcoming conversations. Next slide, please. Now, the most exciting part of today's session, I'm thrilled to introduce our three experienced panelists who truly live and breathe organizational practices. And trust me, I'm not exaggerating. They do live and breathe organizational practices. I'm going to pass it on to Earl, who's the managing director of the California Wellness Foundation. The other two speakers are Nikki Highsmith-Vernon, who's the president and CEO of Horizon Foundation, and of course, Kenitra Fuqua, the program director of Horizon Foundation, which is based in Howard County, Maryland. Thank you. Earl, over to you.
Let me unmute. Thanks, Arpita. Hi, everyone. It's great to be here today. I'm Earl Louie, Managing Director at the California Wellness Foundation, calling in here from Oakland, California. I've been at Cal Wellness since 2006, so I'm one of the long-timers here. And so what I'm going to do today is just talk a little bit about how our foundation has evolved in our health equity, racial equity, community engagement journey. So I'm going to talk a little bit about, again, how the grant-making strategies have evolved, how our practice of engagement with community has evolved, and also how other foundation practices, internal foundation practices have evolved. And I think it's important to kind of go over this history because I think our foundation has come a long way. Philanthropy in general has come a long way. So we're kind of like a case study. I'm sure you're going to hear many similar, there's going to be many similarities to what your foundations have gone through as well. So next slide. So going through our evolution, starting from the left. So our foundation started in 1992. We're a health conversion foundation. Our parent organization was the HMO HealthNet, now part of Centene, but a large HMO in California that converted from nonprofit status to for-profit status in 1992. And so when we launched, our grant making is, again, you have to remember the times, 1990s, we did what a lot of foundations did. We started initiatives that were foundation driven. And then you can see kind of in the other arrows here, we kind of evolved Cal Wellness 2.0, 3.0, and we're kind of on the verge of Cal Wellness 4.0 at the right because we're going to be starting strategic planning soon. Next slide, please. So talking about our early history, again, I wasn't there for all of this, but I've heard a lot of how things were here. But this was our initiative era. And, a big foundation design, multi-year initiatives that were dreamed up by the foundation. And it featured things like a competitive RFP process where we looked for grantees for nonprofit organizations to do very specific project kind of work on these initiatives. So there was input from community and nonprofits. There was each of the initiatives had a community advisory board, but it was mostly foundation driven. With the foundation design, the different elements of the initiative from public policy work, the research the foundation wanted to see, communications, and of course, there's a big evaluation component for the initiative. And so, again, probably like the experience of other foundations, when that evaluation was completed of the initiatives that we did, we didn't get a lot of good feedback from our grantees. It was very predictable. Now we would say predictable, right? Our grantees wished that we were a more responsive funder. They told us that what nonprofits in the field need is core operating support, unrestricted funding, multi-year unrestricted support. And they weren't thrilled that so much of the work was foundation driven instead of just supporting what the nonprofits in the field wanted to see done. And racial equity, racial justice wasn't quite part of that initiative, of those initiatives, even though some of the issues that we worked on, like community violence and gun violence, which we were one of the first funders to address that as a public health issue. A lot of these issues concerned communities, colored, BIPOC communities, but back then the language was underserved communities. So let's move on to the next slide. So we listened to all that feedback in our next iteration, beginning in 2001. We shifted 180 degrees. So instead of running our own initiatives, we had an open application process. We did determine which portfolios or which issues we wanted to fund in, but we didn't predetermine the strategies or what we would fund. But we kind of let that develop organically. And so the open application process, the open LOI process, was really our way of listening to the field, letting them tell us what work they thought was important, on the different issues, in our different issues that our portfolios were trying to work on. And the other dramatic change was multi-year core support. We became one of the early funders for core support and also multi-year grants for core support. And the third bullet, as I said, the letter of interest policy, or the letter of interests that came in, kind of helped us shape the strategic direction of the portfolios. So again, early days of trying to listen better to the field, listen better to the needs of nonprofits, listen and viewing them more as the experts as opposed to the foundation being the experts. Yes, next slide. Thank you. So that lasted until 2014, where we launched our next strategic plan. And we became more comfortable talking about racial equity into our grant making strategies. Previously, we talked about, of course, health disparities. We talked about underserved communities or disinvested communities, but we didn't name race as squarely as we did beginning with our next version of our strategic plan in 2014. And so we continued the open application process, the open LOI process, but we also tried to improve our community engagement and our customer service. And there are a couple of ways we did this. So for example, we, for the first time, created grant making programs centering race. Specifically, we had two initiatives, sort of in a back to the future moment. We did go back to having sort of mini initiatives on trying to address the needs of women of color who were re-entering the community from incarceration, and also women of color and HIV/AIDS prevention. So those two initiatives were very clearly focused on people of color, women of color, and that was sort of the first time that we did that. We also changed some of our practices in the foundation, internal practices, again, try to incorporate a racial lens on all of our work. So we started looking at our endowment and our assets and our investments and who was managing our investments. And so we began to diversify our investment managers to more people of color owned investment firms. And that work's continuing to this day. We also started looking at the racial makeup of our vendors, consultants, contractors, and again, tried to diversify, again, who those folks were. And sort of at the same time, back to the investments and endowment, we also launched for the first time mission-related investing and program-related investing, both MRIs and PRIs. And now, just actually recently, we've made the decision to fully deploy our 100% of our assets. We want 100% of our assets to be mission aligned. So that process again is ongoing, but the board has made the decision to go in that direction. We also made other changes in kind of our grant processes, again, how we engaged and how we dealt with nonprofits and grant applicants. So again, trying to include more of a racial lens in our work, we started asking our grant applicants about the racial demographics and other demographics, gender, and others, LGBTQ identities. We asked our grant applicants to give us information about their board and their executive teams, trying to collect that demographic data. And we also included a diversity, equity, inclusion analysis section in our grant write-ups, just to talk about an organization's commitment to racial equity and racial justice. We also started using our voice more externally, our social media channels, our website, and other means to become allies and supporters of our grantees' work on racial equity and racial justice. Next slide, please. So we are beginning, as I said, the strategic planning process to go to our next framework. And some of the changes that we are looking at are, so one major change, again, our strategic planning committee will have equal representation from community members, board, and staff. And again, that's the first time we did that, or that's the first time that we are doing that. We incorporated community voice a little bit in our prior plan, but not to this extent that there will actually be equal representation on the committee. We also expect that we'll have a more explicit focus on racial justice. I think we, again, have gotten more comfortable talking about race, naming that systemic racism is the cause of a lot of the health inequities in our country. And so we want to double down on that. We also are starting some experiments on participatory grant making. So even now, before the new strategic framework launches, we're involving grantees in designing a sabbatical program. We have offered sabbaticals to nonprofit leaders for some time, but we kind of paused that program and kind of want to launch a 2.0 version of that program, but this time with input from community members about what they would like to see in a sabbatical program. And so they're going to help co-design it, and also nonprofit folks will be on the committee to select recipients of the sabbatical program. So that's just taking some baby steps on a small part of our grant making, but we hope to grow from that in our next version of our strategic framework to be more explicit about participatory grant making. And I think that's it. So now we're in the present day, and happy to answer questions when it's time.
Great. So this is Nikki Highsmith-Vernick from the Horizon Foundation. So we're going from the West Coast to the East Coast, from a big state to a small state, and from a small state to a small county within the state of Maryland. So Kenitra and I are from the Horizon Foundation. I'm the president and CEO, and Kenitra will introduce herself in a moment. And we are a place-based foundation in Howard County, Maryland, and we have the privilege of both working at the local level and also at the regional level within our state and at the statewide level. So we work at all three levels within Maryland. We have about $100 million in our endowment, and we've been catalyzing movements for social change since 1998, so a little bit later than the California Wellness Foundation. So we're going to share our story today of how we've engaged deeply with community, how we've changed our organizational practices to share power. And I'm going to talk kind of about the governance and strategy, and then Kenitra is going to talk about our very specific grant making practices that we have changed. Next slide, please. Like many of you, or all of you on this call, we have all been on our racial equity journey. I'm not going to go into a lot of depth in this slide, but I would say prior to 2016, not quite ready. We were a foundation who believed income differences was what was driving our health disparities. In kind of 2017, moved with caution. We spent a lot of time doing board education, staff education, and we went from sort of targeted universalism to equity to racial equity. And at that point in time, it became a very important pillar of our work, but it was sort of one pillar of our strategy. And in 2021, we kind of committed to go deeper in terms of priorities and principles, really recognizing, as it was stated earlier, that structural racism is at the core and a driving factor of health disparities. And more recently, we have committed ourselves to being an anti-racist, trust-centered philanthropy. And we kind of looked around and said, well, racial equity as a pillar of our work isn't enough. It felt kind of incongruous as an organization. And so we also, in about 2021, launched a strategic planning process that has gotten us where we are today. A few things before I go to the next slide. We really decided at that point in time that our mission, vision, and values really are kind of core governing important DNA needed to be changed. And so when we launched our new strategic planning process, we put a change to our mission, vision, and values right in the center of that process, that we needed really to kind of reflect the organization that we were growing into, and that meant really changing kind of some of our core principles. The second was that earlier we had changed kind of our focus areas, our priority areas, and again, not really going more fundamentally into kind of our governing documents. And again, that was important to us. Next slide. So a couple of things that were really important as we embarked upon this most recent strategic planning process, really kind of our North Stars of being an anti-racist, trust-centered organization, centering community voices and centering the folks who had been most marginalized and most oppressed in our community, and reaching them in different ways. We often talk about voices that are unheard, and I would say we talk about them as voices that were not really asked by us. And had been sort of systematically excluded. And so how could we rebuild that trust in community and build relationships again? And really kind of do thoughtful co-creation between board, staff, and community. Next slide. Like all of us, right? We start with the data. We have lots of data. We can show you lots of data. We can break down that data, thankfully, by race and ethnicity. And we can break it down at a pretty micro level for our community. And so we started with that data, and that data were an important foundation for us. Next slide. But then we really looked at and listened to kind of lived experience. Here are some of the numbers of the folks that we engaged in our strategic planning process. We went and talked to our grantees and community partners, many of them. But then we said, we really want to listen directly to community. And we need different methods to do that. So we had listening sessions and focus groups, particularly in our non-English speaking population. We did a statistically significant survey, telephonic survey poll, 400 community members. And then we brought many people together in a big community summit. And finally, we said to ourselves, so we have all this data, but we really want to listen more deeply. And so we did canvassing. We went and knocked on, actually 1,700 doors were opened to talk about what were the biggest barriers to living a long, vibrant, healthy life in our community. And we had a lot of deep conversations with our community members, with our neighbors, about things that were standing in their way. And I will say that we tried in most ways to compensate our community members for their time and lived experience. It was easier when we were doing it in person. So when we were door knocking and canvassing, we could hand out a gift card. It was a little bit more difficult telephonically. And as was said also earlier by Earl, next slide, we co-created with community. So we also have a planning and evaluation committee of our board of trustees. And we, again, as Earl said, we created a committee that had equal representation from community board and staff as part of that. And, you know, I think the table of food shows we tried to make it a nourishing environment. We tried not to be extractive. We tried to be planful and thoughtful and intentional, and create a sense of belonging with our community and our board, and that continues to today. And we spent a lot of time with this group talking about how we can get to some of root causes and how the strategies that the foundation would like to use and would like to lean in further, and if those strategies were working in the community and how we could lift them up more. Next slide. Part of that is taking the ecological model, and our board has a hard time with like big theories sometimes. So we call it the 4 Ps, and we just translated the model into people power, really, and that's through our grant making, and you'll hear Kenitra talk about that. Changing policy and laws, right? We know that systemic racism is at the root of many of our health disparities, and dismantling many of those structures and policies is important. Putting the public into public health, what kind of narrative change that we need to create in order to get policy and laws passed, and then also kind of proof, how are we learning from our work as we are moving along? And then also, for the first time in 25 years, we changed our mission, vision, and values. Next slide. Our new mission clearly states that we believe systemic inequities, right, are at the core of our work. So we envision a county free from systemic inequities where all people can live abundant and healthy lives. And we recognize that to do that, we need to work side by side with community to build power, advocate for policy change, and dismantle structural racism to achieve better health for everyone in Howard County and Greater Maryland. Next slide. And at the same time, we created a set of values, a new set of values. And these were important to us because we wanted to signal to the community how we would show up differently, how we wanted to show up differently, and that these values were important to us in creating new relationships and sometimes repairing old relationships, and that these would guide our behaviors and that people could check us on our behaviors as well. And that was really important. So a couple of summary points before I turn it over to Kenitra. I think that deeply engaging with community has to be in your organization's DNA. It has to live and breathe in documents that are agreed upon from the community to the staff to the board of trustees. And in some ways, it creates a community agreement that we can all live by and hold each other hold ourselves accountable to, and a way of building trust with community, that these are the new values that we want to lean into. And then if we're not upholding those values, that we want to know. And we have mechanisms in place, I hope, to have community be able to let us know, and Kenitra will talk about those as well. And also, right, your mission and vision and values lead into all the other organizational work that we do, from budgets to programs to internal policy to culture, that cascading effect. We too have done a lot of work on internal culture and in changing our policies and practices across the organization. I think Kenitra will spend some time specifically talking about our grant making strategies. And I think as we have all learned, it's often about the processes that need to change, and often about the culture of the organization that needs to change along with that. So I'm going to turn it over to my wonderful colleague, Kenitra Fuqua, who will begin to talk about that.
Thank you, Nikki. Hi, everyone. Like Nikki said, I'm Kenitra Fuqua with the Horizon Foundation, and I serve as our program director. And one of the hats that I wear is I oversee all of our grant making at the foundation. Next slide, please. So as Nikki mentioned, 2023 was a very big year for us. As we were going through our strategic plan, we were also doing a lot of internal work to our processes as well, which include our grant making. So listed here are just some of the foundation and grounding principles that have been guiding our grant making, we realized early on that we, as a foundation, really had to look internally and think about, how we can reimagine our grant making practices and really make sure that we are being inclusive and really centering trust in all the work that we're doing with our community and our grantees. We have had extensive conversations just around power. We know that there are inherent power dynamics within, being a grant maker, and we're really like seeking and trying to challenge some of those power dynamics. So we're focusing on how do we build more collaborative relationships with our grantees, recognizing that this really allows for our grantees to be able to take greater risk, really lean into some of those innovative strategies, allow us to think more about the learning, and just ultimately be able to produce some more equitable, impactful results. Next slide, please. So this is just some of the changes that we've done to our grant making practices. We really thought about how can we learn more and better partner with some of our anticipated grantees or just new community members. We wanted to think about how can we do some of that discovery phase up front and really think about how we can strengthen relationships and be able to better understand our partners. So what we have implemented this year is what we're calling Hello Grants. And these are really grants that we're providing to our community partners as relational grants. So we are giving organizations $6,000 to just spend time with us. Oftentimes we work with grantees and we're asking them their thoughts on so many things, and we want to really be able to just compensate our community for and not just feeling like we're just being extractive and just pulling from their thoughts and ideas. So we have a set of grantees that we're piloting this with that's about a 2 to 3 month project period. And it's really all about, tell me about your organization. What are you passionate about? What are some of the challenges in your organization? Let me tell you about the foundation. What are some things that we have in alignment? So that's something that we're very excited about and that we piloted this year to just really think about how we strengthen our relationships. As Earl mentioned earlier, we've talked a lot about just more flexible funding. We're providing opportunities for our grantees to have longer grant terms and unrestricted grant operating dollars. We know that this really allows our grantees more innovation, emergent action, and just really think about the sustainability of their entire organization. Also within our grants, we have considered different and more accessible grant applications. We actually just had a grant RFP to close yesterday, and we were telling our potential grantees that this application is going to look completely different from other applications. And I'll talk a little bit more about like what co-creation it means to us. But in these applications, we weren't asking them for a budget. We weren't asking them like, what's your project? What do you want to work on? We really wanted to get to know them better as an organization. What are you passionate about? What does racial equity mean to your organization? What does power building mean to your organization? What are some examples, or how would you do that in the community? So we've really been exploring about how we can just get to a deeper level of relationship or get to know our grantees, our potential grantees a little bit more. We've also simplified and streamlined our grant reporting, not just focusing on a mid-year and final report, but focusing on dialogue and learning and that mutual accountability. So some of our reporting looks just like a check-in call with our grantees. And instead of them having to write things and submit things to us, we're capturing all of this information into our system and trying to just relieve some of that administrative burden from our grantees as well. And also just thinking about different ways to capture their stories. So video and storytelling, again, don't want to just have them write out what the journey has been for them, but want to walk side by side with them and be able to capture that in real time with them as well. Next slide. So this is just an example of kind of like what our grant making and engagement process has looked like. It's probably very similar to what your process looks like at your foundation. I will say we, through every step, we have really tried to center community and really be able to learn and listen from them. So even we earlier this year, as we released our strategic plan, we did focus area open houses. So we did virtual conversations around our focus areas, and we connected with over 120 organizations with a small but mighty team of 5. but really just learning from our organizations, who's in the community, what issue area that we're working on do they have experience in, and how can we work better together. And then we, like I said, we just recently released the RFP process, and we're currently in just the beginning stages of reviewing applications. But all through this, we've had a lot of different touch points that we've had with our community members. Every Thursday, and this was born out of our community summit that Nikki mentioned. Every first Thursday, we have a community convening. It's led by community. We just offer the space for it, and we offer light breakfast for them, and they're able to come in and engage with their residents and neighbors and just talk about issues that are challenges or activities or strategies that they're seeing in the community and how they could potentially work together. So everything is led by a community, and we're just a place for them to come and gather. We have ongoing coalitions where we're bringing in new partners, we're exploring new vendor relationships, and just providing just different opportunities for the community to connect with the Horizon staff and board. Next slide, please. And that last bucket on that previous slide, something new that we're doing is what we call our new grantee experience. And this is just how, as we have picked our grantees and heard from them and what is important to them, this is how we're gathering them together and creating community. So I talked a little bit about co-creation. And this is really together with our grantees and our foundations, we're developing those equitable decision-making approaches to advance these complex issues in our community. So in our application, we didn't ask them to submit a proposal on like what they would do, because we believe together we can come up with that. So for our application, we, like I said, we really just want to know, like, are they a good partner? Can we work together on these issues together? And so now that as we are picking our grantees, we will come together and everyone will be able to explore together like what solutions to these issues are in our community will look like. Full transparency, this is new for us. We're still figuring it out as we go, but I think we owe it to our community to really center them and be able to hear how they would want to co-create on these solutions. We're also pulling all of our grantees together through a collaborative learning journey where they're going to come together in quarterly meetings to really think about how they can advance and strengthen their racial equity and community organizing principles. So we have different activities and coachings and trainings to be able to support them in that as well. And then we know that each organization is uniquely different. And so we'll be offering technical assistance in areas uplifted by our grantees as well. And I mentioned our video and storytelling a little bit earlier. Next slide, please. And I know we're probably approaching time soon, so I'll just speed through a little quickly, but just wanted to emphasize, as Nikki stated, that a lot of this work is thinking about what do our internal practices look like. We have spent a considerable amount of time of just what our culture looks like at the foundation. We have committed to building trust as a staff, and we have done a lot of activities and a lot of implement a lot of strategies and just think about how can we be vulnerable with each other, how can we build trust with each other. If these are the things that we are seeking in the community, we recognize that we have to look inside of our organization as well. We thought about our practices as grant makers. What are some of the skills that our staff need? How can we really call upon our staff's lived experiences and also enhance their technical skills as well? And as Nikki mentioned, what are those structures and processes that need to be changed and ingrained in our organization to continue on this pathway? And then next slide, please. And then the last thing before I turn it quickly back over to Nikki is we're thinking about, what does our learning and evaluation, like what does that learning journey look like? And we have been incredibly blessed to work with a group called Mirror Group, and they're serving as just an evaluation, a learning, a strategic partner with us. They're helping us document the implementation of our strategic planning in real time. They understand our foundation and how we're centering race in everything that we do, and they're able to just walking step by step and just mirroring back to us what they see, and really allowing us to just hold ourselves accountable to the community. So are we acting on everything that we said that we're going to act on within our strategic plan, and being able to provide a space for our community members to be able to kind of lean into that accountability. So I'll pass it right back over to Nikki so she can wrap us up, and look forward to the questions later.
So next slide, I'll just wrap up by saying we deeply believe that when we center our community and they decide what's important to them, that we build trusting relationships and build power, that great things can happen. And most recently in Maryland, we have passed a minimum wage increase. We have expanded health insurance to newly arrived immigrants. And we have achieved a 25 million dedicated revenue source for 988 to decriminalize mental health. And so we hope that this great work will continue and look forward to the Q&A session as well. Thank you. Thanks, Kenitra.
Thank you so much to all our speakers. I appreciate the timeline from both the organizations. I think it was very helpful to provide context for all of us as attendees. Also in the conversation, I saw, we all heard themes of racial equity, trust-based philanthropy, centering community voices through lived experiences, lots of pearls of wisdom weaved in there. While the questions come in chat, please feel free to type it in chat. I know we do have one question, which I'll bring up, but before we jump into that, I did have a question myself. The question I have is, how do you define success in achieving health equity within your organizations? And, I'll give a chance to both to answer, both organizations.
Do you want to go first?
Sure. We're redefining that, right? It used to be metrics, and it used to be, we were a health foundation that worked on chronic disease and end of life care and mental health. And we had very specific metrics associated with achieving those better health outcomes, both in terms of reducing disparities by race and increasing health overall. But we're also, I think, part of the goal of bringing the Mirror Group in is, how are we as an organization changing? And what are the practices that we need to learn and do differently? And how do we hold ourselves accountable to the values that we uphold as an organization of being an anti-racist organization, earning trust from community, trying to be more catalytic and building power? Those are like the secret sauce ingredients that we would like to know if we are behaving in the way that we want to, in order to create the type of relationship and trust that we think is necessary to create greater change. And that's a harder way of, like, those are not metrics. And that is a lot of community input and community conversations and trust building, and somebody who is sort of external to us, telling us how we're living into our values or not.
Thanks, Nikki. I need a minute because unlike Nikki, I'm not the CEO or of our foundation. So I need to think, do we have an organizational definition? Or so a little bit organizational, but a little bit is just sort of my opinion. So please note that. But I think what we would say is that what we've learned is that health equity kind of depends on the health of our nonprofit community, right? The nonprofit groups that we fund, our grantees, that we have, if we have a strong, thriving nonprofit infrastructure and ecosystem, then good things will happen. And so we've been thinking about how to do that, to strengthen the capacity of our grantees and partners, but also thinking about how to build infrastructure, permanent infrastructure to do that. So some of the things that we've leaned into, like Horizon, are power building activities, because we see that, again, building power, community organizing and integrated voter engagement, and of course policy and advocacy work are all needed. But sometimes the infrastructure to support that work, to provide the capacity building and technical assistance to a lot of nonprofits on the ground, don't exist. And so we think about capacity building and technical assistance, on those kind of technical things like power building and organizing. And of course, there's just kind of the normal capacity building that we think of helping nonprofits be more sustainable, help with fundraising, help with board development, coaching for executive directors. So we kind of think you need to do both, that kind of standard nonprofit capacity building, but also this other technical infrastructure or capacity building to support things like power building and movement building to achieve real change.
Thanks, Earl. There's a question directly for you. Lydia, if you wanted to unmute, I'll let you ask it. If you're unable to unmute, I can just read off.
Sure. I was just really interested in the question or the analysis that you referenced on the commitment of an organization, an applicant organization's racial equity, because this is something we've wrestled with. We request anti-discrimination policies, right? What does that really tell us about kind of how that's applied, organizationally? Not much, right? They have a policy on the books. That's all we really know. So I'm just really curious if that's something you're able to share.
Yes, I can't recall the exact language, but I'll look it up and I can share it with you. But it's something like it's a fairly open-ended question. Tell us about your commitment to diversity, equity, and inclusion. But like I said, we combine that with asking for the demographic data along, race, ethnicity, gender, of the board of the organization, also the executive team of the organization. And then our grant makers will follow up and have a conversation based on kind of what they see, in those responses. But I can follow up with you to get the exact language, but it's fairly open-ended.
Thank you.
Yeah, I can add a little bit to Earl, because we do something very similar. So saying we ask some demographic questions just around organizational staff makeup, board makeup, what percent is non-Hispanic ethnicity, things like that. But then, like, especially in this application, we've asked just questions just around what does racial equity mean to your organization? How does that show up in some of the practices in your organization? What does power building mean to your organization? Name some ways that you've done this or would like to do this. We've asked them to maybe talk about trainings that they have completed or would like to complete. So recognizing that each grantee is at a different space in this work. So want them to think about, what are we doing now, but like what are things that, if given the opportunity, like we can do in the future as well.
Thanks for addressing that. There's a question that Nikki and Kanitra can respond to in chat from Mary Kate. One overarching question that sort of comes up as, Cal Wellness and Horizon Foundation was sharing their journey. I was wondering about what challenges should organizations expect while they are working towards changing internal practices. It's, as you both noted, not an easy journey. A lot of thinking goes into it. It would be great to hear about some of the challenges one should anticipate.
I can start. I'll let Nikki elaborate more if she wants. I mean, I think the biggest challenge, which I don't even know if it's a challenge because it's something that we are creating and working against ourselves, is time. So thinking that you have to do it right away, and that's something that we have just looked internally at our foundation, is like, it takes time to do this. I mean, I think you saw our racial equity journey, and back in 2016, we weren't even talking about racial equity. So I think it's like time and the patience, and knowing that like we're in this for life, and these systems of oppression didn't just come out of nowhere. So there will take time to think about how we go up against them. And then I also think that we are lucky to have an incredible CEO that believes in the mission of the foundation, but also an incredible board. I think our work would be a lot more challenging if our board wasn't on board with what we're doing. But we've also spent a lot of intentional time in working with our board and having conversations with our board and letting them trying to understand, educate on why we only focus on, not only, but why we prioritize policy and systems change, why we are trying to change practices, and why we are going at the root causes and focusing on structural racism. And I think that like if you don't have the internal buy-in from staff, board, and leadership that can be a challenge as well. And I think it's just the nature of the work that we're doing. Equity, racism, racial equity is sometimes hard to talk about, even in a staff of 10, where we've had a lot of conversations and have built great trust with each other. It's still uncomfortable. So thinking about how do you replicate that even out within the community and try to have these hard conversations with them. That's a challenge that you're not going to get it right all the time. But just recognizing that it's gonna kind of be hard, but like what are the skills and how can you work with team and community to kind of like pass through some of those challenges. So
Sorry, I can just add briefly. I agree. It's time. Our foundation has not. We've gone through some trainings and steps with racial equity, racial justice consultants, but we haven't fully committed to like doing like a year-long or 2-long process. But instead, we kind of just jumped in and started doing things. Started tackling some of the relatively low-hanging fruit, like changing some of our foundation practices. So things like you heard about, like asking for demographic data from applicants, looking, changing, trying to find investment managers of color, to manage our assets. So we kind of started doing things, but we haven't, we ourselves haven't fully gone on that long journey yet. But we are kind of at the stage now with our strategic planning process of being more intentional about that. But so I think it's just finding the time and the commitment to do the work.
Thank you all for sharing your insights and thoughts. I could keep asking questions, but I know people have to resume their lives and but our conversation doesn't need to end at this webinar. If you are still interested and continue to join our workshop series, there's a third one on October 23rd, same time, same Zoom link if you're already registered. And the focus is how to authentically engage communities, where you'll have a funding partner along with their community partner, and they both will sort of share their experiences and have the hard conversations as well. So we hope to see you at our third webinar series, and I really appreciate some of you who have joined, familiar names who joined the webinar, the first workshop, second one. Hope you'll be able to join the third one, and hope to see you then. Thank you so much again to all our 3 speakers and Partners for Health Equity. There's a poll, end of workshop survey, not a poll, apologies.
Yes, if everybody could take a moment to fill out the end of workshop survey, that would be really appreciated. It helps us with ideas how to improve future workshops. Also, we have another workshop series coming up on October 17th, and the series is going to focus on mobilization of community around health. We will be highlighting voices of community workers, activists, public health workers from Latin America and Caribbean communities. So that is again at 5 p.m. October 7th, if you are able to join. And as Arpita mentioned, the last one in this session is on the 23rd. Thank you all so much.
Bye, everyone.